Welcome back to Living Local. The gold standard to detect cancer early is for women to get regular mammograms, but now there's new recommendations for how often women should get them. Joining us in studio today to talk about the new guidelines is Dr. Simmi Fain, radiologist and breast imaging specialist at Genesis Health System, which is also this segment's sponsor. Dr. Fain, thanks so much for being here. Welcome to the show. All right, so talk to us, what is a mammography and how does it work?
So a mammogram is a specialized type of x-ray that's used to check the breast tissue for breast cancer or other abnormalities. They usually only take a couple of minutes to do, and all our mammograms we do are what's called 3D imaging, which is the most accurate way to check for breast cancer.
Okay, and why is it so important? Because we always hear, you got to get your mammogram, a lot for, for women. So why is that so important?
Good question, Brandy. So studies show that about 1 in 8 women is going to get a diagnosis of breast cancer at some point in her life. And mammography is the only test that's actually been shown to reduce your risk of dying from breast cancer. The reason for that is because mammograms detect breast cancer early, when they're at their earliest stages, the smallest sizes, and that's when they're the most treatable. So that improves your chances of survival. A smaller surgery, more effective therapies, etc.
Okay, so the current recommendations, they've changed, and younger women are now being advised to get a mammogram. So talk to us about the changes and how they differ from previous advice.
Good question. So a little bit of background on that, Brandy. There are a few organizations in the U.S. that make recommendations for cancer screening. The American College of Radiology is what radiologists belong to, and we have said that women should start getting screening at the age of 40 and get an annual mammogram, a yearly mammogram, so long as they continue to be in good health, meaning so long as if we found a cancer, you'd want us to do something about it. The change you're talking about is with an organization called the U.S. Preventative Task Force, and this is made up of a bunch of other doctors, and now they've also come on board and said, instead of starting screening at age 50, which is what they recommended in the past, they also now recommend starting at age 40. And that's because, the rates of breast cancer are creeping up, and they're creeping us up fastest in that 40 to 50 age group. So when we start screening at 40, we're actually saving more lives. Again, we're finding cancers at an earlier stage.
Okay, all right. You mentioned radiologists. So talk to us a little bit more about radiologists and how they're involved.
So a radiologist is a doctor that's an expert in medical imaging like x-rays, CTs, MRIs, ultrasounds, and a radiologist who specializes in breast imaging is the one that's going to read the mammogram. They're going to check it for abnormalities, and at Genesis our radiologists also do the next steps if something does come back as abnormal. We do the additional pictures, the additional tests, and we even sometimes do what's called a needle biopsy, taking a small sample to figure out if something is cancer or not. And that kind of leads me into, it's actually really important to realize that where you get your screening done does matter. At some organizations, they really only offer screening, but at Genesis, we offer beyond screening as well.
Okay. Talk to us a little bit about your background and with breast health and imaging.
Yeah. So I'm a radiologist by training, and I've had additional training to specialize in breast cancer imaging. And all the radiologists who read mammograms at Genesis have had additional training to be experts in that. So that means we not only read mammograms, but we also read breast MRIs, breast ultrasounds. We do the biopsies. And that's something that's really special about Genesis. Not every hospital system has those radiologists that are specialized in breast cancer, and we really can offer that.
What is the process, and what can women expect when they come in and their journey?
Yeah, so basically when you come into the clinic to get a mammogram, we have a comfortable waiting area. You get changed into a gown and we take you over with our technologist to the mammogram machine. Again, it's a couple of sets of images. It takes only about a couple of minutes to do, and then you leave same day, and then a radiologist same day starts looking at those pictures and figuring out if anything is abnormal. Brandy, about 1 in every 10 screening mammograms actually does get flagged as having something unusual about it. Not all of those are going to be cancers. Some of them are going to be benign breast tissue. Some of them are going to be non-cancer masses. But you as the patient don't want to be the one that then has to go figure out, okay, how am I going to get this worked up? Where am I going to get my biopsies? At Genesis, that's all streamlined for you.
I love that. I love that. What's the process like, though, for someone who has not had a mammogram?
It's very easy in the Quad Cities. Just call 421
Okay.
X-ray. That'll get you plugged in with our schedulers, and we'll get you scheduled with the mammogram.
It's as easy as that.
It's as easy as that.
And you can go right back to work,
You
too.
can go right back to work. Again, it's a very short appointment, and there's no restrictions on your day afterwards.
Yeah,
So,
yeah.
yeah.
All right. Well, some great advice you gave us, and get out there, get your mammogram if you haven't already, right?
Yep.
All right. Well, thank you again for
Thank
coming
you
on
for
the
having us.
show.
It's a pleasure.
Again, this segment was sponsored by Genesis Health System, and for more information, go to genesishealth.com. We'll also have all those details posted on ourquadcities.com.